The Future of Multiple Sclerosis Treatment and Awareness by Kenneth J. Thompson. Multiple sclerosis is a disease that doesn't discriminate. While it affects women nearly twice as much as men, everyone is still susceptible to it. Approximately 2.5 million people around the world have been diagnosed with it. In the United States, it has been estimated that nearly 500,000 people are afflicted with it, while here specifically in the state of Georgia, nearly 18,000 cases have been reported. So far, we know that multiple sclerosis is a chronic disease that damages the nerves in the spinal cord and brain, as well as the optic nerves. Neurologist P.K. Coyle writes, "Unfortunately, the diagnosis rate for MS approximates 5 to 10%, even by experienced healthcare providers." It is important to note that in recent diagnosed cases, African American women had a 47% higher risk of MS than Caucasian women, while Hispanic and Asian women had a 50% and 80% lower risk compared to Caucasian women respectively. Another conflict worth mentioning is the state of mind that the caregiver may endure. A study shows that there are approximately 16% of caregivers taking psychotropic meds or psychotherapy, and approximately 20% have been diagnosed with probable mental disorder. With these trends spreading out to other ethnicities, no one is immune to multiple sclerosis. This is now the ideal time to create even more awareness in lieu of the rise of multiple sclerosis cases that are taking place in other ethnicities, and who knows how far its reach will go. According to a study done by Kaiser Permanente, researchers examined the electronic health records of more than 3.5 million members of Kaiser Permanente in Southern California between January 2008 and December 2011. They identified 490 new cases of MS. Of these cases, women comprised of 70% of the patients, not an unusual fraction for people with MS. However, surprisingly, the patients included 84 African American women. That means the annual incidence of MS in African American women was at 10.2 cases per 100,000 people. That's not a great risk for an individual, but it was higher than the annual rates for Caucasian, Hispanic, and Asian women, who were 6.9, 2.9, and 1.4 per 100,000 people respectively. With the advent of this type of research and more multiple sclerosis cases being identified outside of the Caucasian race, awareness is critical because the onset of multiple sclerosis is spreading and its cause still is unknown. The general public should care and be informed because numbers don't lie. Based on the number of people that have been diagnosed in the United States with MS, the life expectancy for people with multiple sclerosis is nearly the same as for those without MS. Because of this, multiple sclerosis statistics place the annual cost of MS in the United States into the billions of dollars. The multiple points of view in this research will be the person living with MS, the doctor who treats the patient with MS, and the Director of Clinical Chapters Program of the National Multiple Sclerosis Society, Georgia chapter, as well as the caregiver. In treating all perspectives fairly, this story will represent and allow each participant to share his or her expertise and knowledge, thus keeping the story bias-free from any perspective of the author. The first subject matter expert to be interviewed is Hilary Lamont Burke, MSW, who is the Director of Clinical Chapters Program for the National Multiple Sclerosis Society, Georgia chapter. Dealing with MS patients keeps Hilary in touch with new treatments that are available, as well as the symptoms an MS patient endures. The second subject matter expert to be interviewed is Tony Smith, Director of Nursing for the Multiple Sclerosis Center of Atlanta. Smith has worked with many MS patients and also has a personal experience with MS, having had a cousin, a long-term staff member, and a very close friend diagnosed with the illness. Multiple sclerosis is not a mainstream story according to the analytics in Google Trends, and since 2004, there has been a steady decline in the number of searches regarding information as it relates to multiple sclerosis treatment, as opposed to breast cancer. Breast cancer consistently spikes throughout the years using many media outlets such as professional sports, walks, races, and plenty of news coverage. Unlike breast cancer, many people are unaware that multiple sclerosis too has an awareness month. With all the respective data, breast cancer gets more awareness than multiple sclerosis. Now, the targeted audience is African American and Caucasian women between the ages of 28 and 58. This is based on research conducted on MS patients. And what does all this mean? Well, in terms of people and places, this means that multiple sclerosis could strike any person, anytime, anywhere. And since the cause is still unknown, it is important that every person is aware of the symptoms so that the earliest detection can be obtained and treatment started. It also means, in the terms of professions, with increased cases, the additional research is a necessity in determining the cause and cure, which could ultimately raise the awareness and educate society, thus taking the stress away from the caregivers as well. The National Multiple Sclerosis Society is forming chapters throughout the United States to create and promote awareness, education, and support. There are also multiple sclerosis walks to help fund research while creating this awareness. In striving toward the future, multiple sclerosis awareness and research has been fundamental at best in having daily treatments reduced to one monthly treatment. So, as we move into the future, individuals with multiple sclerosis can be hopeful and optimistic that a cure will one day be found. Thank you.